Bedside locker cleaning. Before you start work, check the appropriate safe system of work, including chemical safety data sheet, COSH assessment and risk assessment before commencing the task. Ventilate the area where possible. Clean your hands as per the local policy. Check for cuts and abrasions. Cover with a waterproof dressing if required. Select, check and put on appropriate PPE as per the risk assessment. Please refer to the national standards for healthcare cleanliness. Assemble colour-coded equipment and/or machinery. Using appropriate PPE, prepare the approved cleaning, disinfecting agent according to manufacturer's instructions. Place caution signs. Ensure cleaning chemicals, disinfecting agents are kept safely locked away, either in the trolley or cleaning cupboard at all times, including in between tasks. Check for any damage to the area and report it in line with local policy. If you notice any signs of pest infestation, report as required. The tools you'll need to clean a bedside locker are caution signs, appropriate PPE as per risk assessment, cloths, disposable cloth or pre-impregnated wipes, disposable non-abrasive pads as per manufacturer's instructions, bucket with cleaning disinfecting agent. We'll now talk you through how to clean a bedside locker. Make sure the work area is safe and that you are not causing any disruption to the patient. In line with your local policy, ensure that items have been removed from the locker to facilitate cleaning. Damp wipe all the surfaces, cleaning the edges first. Extend the wipe underneath the bedside locker, including the sides, drawers and fittings, using an S-shaped motion. Using a clean cloth, clean the door opening handles and grips. Please ensure that the underneath of the door handle is cleaned. Use the disposable non-abrasive pad to remove any stubborn marks. If the locker is empty, using a clean cloth, open and clean inside. Clean inside the locker on request during the patient's stay and always on discharge. Leave the area to dry and replace any removable items. When you've finished the task, check all areas are completed, correctly dispose of or clean materials used as per your local policy. Always check with your supervisor if you are unsure. Dispose of any waste or debris as per your local policy. If using cleaning disinfecting agents, ensure you lock them away safely. Clean and dry all equipment. Clean and remove caution signs when the area is safe and dry. Store equipment away safely. Charge battery or machinery as per manufacturer's instructions. Correctly dispose of all PPE. Clean your hands. Close ventilation where necessary.